Amazing. So welcome everyone. So this is our first ever Climate and Health Opportunities Fair. I'm really excited about this. We have a lot of current and past Next Gen ambassadors here. The Next Generation Ambassador Program is a program for young and emerging health professionals to strengthen their skills in climate and health advocacy. It's great to see a few of you here. And then I know we have a bunch of other young and emerging health professionals from MS4SF and other partner organizations of ours. So it's really a pleasure to have you all here. So the way this is going to work is we have 8 speakers. Ons unfortunately had a family emergency and can no longer make it, but asked if I could put their email address in the chat, which I will, and you can reach out to them directly. And I'll be speaking a little bit about what opportunities they have generally. Otherwise, we have 8 wonderful speakers here who will talk about different opportunities that you can engage in the climate and health field. I know a lot of you are already very engaged, but a lot of it has to do with PSR work or just different domains in the climate and health field you can become involved in. And then afterwards, we will have a little breakout room session where you can go and visit different speakers and talk to them about the opportunities more in depth. So that's how this will work. So if you do have specific questions, please save them for the end to ask specific speakers. I will also be sending out a flyer with all of the different major details of the opportunities, as well as all the speakers' email addresses, and also just in general opportunities to engage with PSR more generally. So those are a few housekeeping notes. With that, I'm going to turn it over to our first speaker, who is Todd Sack. I'm going to introduce each speaker and then you can all take it from there. So Todd is a gastroenterologist and hepatologist in private practice and serves as a member of PSR's board of directors. He is editor of MyGreenDoctor.org, a free environmental service of the Florida and World Medical Association that helps medical offices adopt sustainable practices. He is a member of numerous environmental and medical organizations, including the Council for Healthy Floridians of the Florida Medical Association, GEA's Clean Power Advisory Group, and the Florida Energy Commission, where he chaired its Climate Change Advisory Group. He also serves as a board member of PSR Florida, the Museum of Contemporary Art Jacksonville, the Jacksonville Environmental Protection Board, and We Care Jacksonville free clinics. All right, take it away.
Okay, screen share. Okay, we got it. And slideshow from the beginning. Hooray. Okay, you see my slides, eh? So I'm Todd Sack, and I'm speaking as Executive Director of the My Green Doctor Foundation, and we're seeking a communications manager, a very part-time communication manager for My Green Doctor. So I'm going to tell you why this is important, what My Green Doctor is, and what this opportunity would be as a communication manager. Becca, thank you for doing this program, by the way, and thank you for introducing me. I have no financial disclosures. I do research on how best to teach climate change and health to patients and to health professionals. I do a lot of work helping professional societies develop policies on climate change and environmental health, and I'm this year president of PSR. You all know PSR, but I do want to point out that we're now recruiting our next executive director, and Anna Lanakis on this call is on our transition committee. Thank you, Anna, for your amazing work, Anna. And if anyone would like to receive the job description, please email me. We'd love to get it to you, and also to any organizations that you're a part of, to share the exciting opportunity to be our next executive director. I'm not going to talk much about climate change here, but just keep in mind the health threats of climate change, which is really why we're all here, and the imperative that we abandon fossil fuels for energy and transportation. This is Jacksonville, Florida, my town, after just a minor hurricane. You can see the economic and emotional devastation and potential health devastation as well from climate change here. So where can we engage on climate change, environmental sustainability, and health equity as health professionals? Well, in our homes, of course, in our hospitals, in our medical schools, in our churches, mosques, and synagogues, in our governments, and our professional societies. But My Green Doctor helps folks to engage in our practices and what we do in our offices, our practices, our clinics, and what we teach to our patients. What are the benefits to practice of going green, of adopting environmental sustainability, of working on climate change? It saves money by lowering overhead costs, decreases our uses of resources, energy, water, chemicals, and others. We can improve office teamwork and staff morale. We create a better office experience for patients. I think enhance the public relations profile of a clinical office and improve patient trust. We can create a healthier office. We can encourage wise choices by our patients and families and improve community health. The program that I'm looking for help with is My Green Doctor, which is a complete environmental sustainability practice management program. We're actually available at two websites, mygreendoctor.org in English and mygreendoctor.es for our Spanish preferred health professionals and patients.
Turn on the heat.
And we had about 10,000 users in 2022 from more than 80 countries. 29 health professional organizations now provide My Green Doctor to the members as a free membership benefit. So our communications is often with the organization, those organizations, and with their members. My Green Doctor is comprehensive, science-based, non-political, and easy to use. It's for any outpatient clinic practice or outpatient center, and most offices save money in the first month, and that's a big part of our pitch to health professionals. You're going to save money and create a healthier community using My Green Doctor. These are our current 29 participating organizations that share our communication materials with their members, and you can see groups like the World Medical Association, the American Academy of Family Physicians, and others, and Physicians for Social Responsibility as well. So we're very grateful that PSR has been participating now for many years. And altogether, we reach about 350,000 health professionals and managers with our communications. So almost done. Communication manager for My Green Doctor. What you will learn are the principles of environmental sustainability and outpatient healthcare practices. We'll learn together methods of communicating with health professionals and managers, sharing climate change knowledge with patients, and managing a small nonprofit, because you really get into the weeds with me about how we manage this organization and get the word out. Responsibilities for our communication manager. I'm looking for someone who has 1 hour to maybe 3 hours per week, but generally 1 hour a week. It would be includes part of it would be Zooming with me once a week to talk about these ideas and to plan our work. I'd like the person to review and update our current My Green Doctor communication strategies and messages, particularly focusing on how can we make the messages more effective at reaching and motivating health professionals to engage on climate change. I'd like the person also to manage our social media posting, particularly Instagram and Facebook. We've kind of abandoned Twitter for obvious reasons, and we can offer a little bit of reimbursement, $20 per hour for getting engaged with us. The requirements: we're looking for health professional trainees or recent graduates, and of course, folks interested in environmental sustainability and climate change education. I'm going to stop right there. Thank you for helping our colleagues to go green. My email is there, mygreendoctor, mygreendr@gmail.com. I probably can't stay for all the breakout sessions because it's 1 a.m. where I am. So write that down, email me if you'd like to chat more about getting involved. It'd be fun to do this with you. Thank you.
Thank you so much, Todd. That's such a wonderful opportunity, and we really appreciate all the work that you do. So I will be sending out email addresses of all the speakers, including Todd, and thank you for being here so late. Up next, we have Emma Hines. Emma Hines is a senior associate in RMI's Carbon-Free Buildings program, where she works on the climate, health, and air quality co-benefits of building electrification. Prior to joining RMI, Emma participated in a 2-year fellowship with a climate and health program at the Centers for Disease Control and Prevention, the CDC, and taught for the Climate Change and Health online certificate program with the Yale School of Public Health. All right, Emma, take it away.
Thanks, Becca. Let me get my slides pulled up quickly. All righty. So, hi everyone. My name's Emma. Like Becca said, I'm speaking to you on behalf of RMI today, which is a nonprofit working to accelerate the clean energy transition. And in my quick presentation today, I'm going to cover a couple high-level and mostly volunteer opportunities to get involved in advocacy around gas stoves and building electrification more generally. And for folks who are interested in engaging further, I'm looking forward to talking in our breakout sessions and hoping that this can start a little bit of a dialogue between us, that we can plug you in, no pun intended, to relevant opportunities when they arise. So in case this is a new topic for you, here's a couple of the reasons why we care about gas stoves and indoor air quality and building electrification as a solution. So we as humans spend about 90% of our time indoors, meaning that we have really high exposure to poor indoor air quality. And the EPA states that indoor air pollutant levels can be much higher than outdoors, although I realize that there's some very poor air quality going on outdoors in large swaths of the country today. So maybe this slide doesn't feel super relevant, but homes with gas stoves actually have much higher levels of nitrogen dioxide emissions than homes with electric stoves. And this really matters in the long term because it has real health impacts, especially on children. The most recent research has found that over 12% of current childhood asthma burden in the US can be attributed to gas stove use. And at this point, based on this growing body of evidence against gas stoves, many public health and medical organizations have made formal statements on the health risks posed by gas stoves. And going further, some have really started to engage in education and advocacy on this topic. And of course, PSR has been central in this work, but here are a couple of the other logos of other organizations who have begun engaging on this topic. So I wanted to bring a couple of opportunities to you. Some are coming up over the next couple of weeks. Some I think we're going to need to talk a little bit more about in breakouts with interested folks. And then otherwise, just a couple of high-level opportunities that we can help customize for you just depending on your interests. So PSR actually has two upcoming trainings on gas stoves. One is a media training with the fantastic folks over at Sunstone Strategies, and the other I think is a little bit more of a general introduction to the health harms posed by gas stoves. So these are in June and July on the 13th of both months. So I would encourage you all to check out those trainings if this topic is interesting to you. But more generally, I also wanted to share a couple of broad opportunities on how we over here at RMI have been engaging with healthcare professionals in advocacy and education on this topic. So I have a couple of categories for you. Obviously, we love to plug health professionals into policy efforts because they are trusted and effective voices in this movement. This can look like a lot of different things. It could be writing op-eds for your local media outlets. It could be participating in oral or written testimony, speaking to the media on health science, lots of options here. But if you're interested in going a little bit deeper, some of your other options could be things, excuse me, like educating your patients and other healthcare professionals. We have a fact sheet that I can share with folks that talks through some of those options on how to get started talking to patients and your colleagues about this. Other folks have been really interested in working with their medical societies or associations to pass resolutions or policy statements on this topic. And again, that's something that we can give examples of. And then some folks are also really interested in taking action on healthcare sector decarbonization to impact building emissions in the place where you spend all of your working hours. So overall, lots of options for getting started. I have two discrete advocacy opportunities that I'm happy to talk to folks about in breakout rooms, but they're a little bit nitty-gritty to share in the large group. So let's save it for then. But otherwise, if you're interested in doing some type of advocacy work on this topic, please do reach out and we can help create an opportunity with you too. My last slide is just a couple more ideas for longer term engagement. Join a chapter of a health organization like PSR or the Medical Society Consortium on Climate and Health. Join a coalition like those based out of the Midwest and in California. And if you're looking for a full-time role, of course, RMI is always hiring, but there are many other organizations now working on this topic too. Folks like Rewiring America, physicians, scientists, and engineers for healthy energy, and many more. So please check out all of those. I have a lot of links for folks who join me in the breakout session, and otherwise, here's my email address, which I can share again in a little bit with folks. But looking forward to chatting with more of you in just a bit. Thanks.
Thank you so much, Emma. I really appreciate it. And PSR also works on building electrification. RMI does a great job as well and has wonderful fact sheets, even if you just need some education. So thank you so much. All right, next up we have Marjane Moini. Dr. Marjane Moini currently serves on the board of San Francisco Bay PSR and is the co-chair of the Environmental Health Committee at San Francisco Bay PSR. She is passionate about health equity and environmental justice and works closely with several community advocacy groups and environmental justice organizations. She is also passionate about supporting youth in their environmental health activism and mentoring medical students and residents. She has held faculty positions in radiation oncology at both Johns Hopkins and UC Davis medical centers prior to her retirement from full-time practice. All right, Marjane, please take it away.
Hey guys, so I'm just going to share my slides really quick. I know we don't have a lot of time. Let's see if we can do this quickly. There we go. So, hi, I'm Marjane. So I just wanted to go through just a few things, just a little background about what we do in California. I work primarily with our SFB chapter, but I also work with PSR LA and PSR Sacramento. And I just kind of, in California, we have certain opportunities that some of them overlap with national opportunities. So we could create, some kind of offsite projects for you guys if you're particularly interested in topics I'm going to talk about. So, we're all health professionals or inspiring health professionals. We're interested in health equity. And we kind of just going through a quick background in California. How did we get where we are to this health disparity? There were actually discriminatory policies in place that brought us here, all the way from 1850s up to 1998. And we're still actually fighting with some policies that are actually creating structural disparities. So you all know about redlining. I'm hoping that you, sorry, I don't know where to move this to get it off the screen. Here, this may be better. There you go. I don't know if you're familiar with this paper that they actually looked at redlining and the neighborhoods that were previously redlined in 1930s, and they looked at air quality today. This is from Morella Frash's lab. She is one of the public health scientists at UC Berkeley, and she does a lot of work on, health disparity, and she's a true ally. So if you look at these maps, these are neighborhood grades in 1930s. These are what they're called the best neighborhoods. I live in Oakland, so I took a picture, an image from the Oakland kind of maps, but this, you can see this across Bay Area and the rest of California, it's and elsewhere in the country. That these reds, what you see in red is where in 1930s were considered kind of neighborhoods that were are not actually appropriate to give loans to people. People's businesses in these neighborhoods were not supported. So if you look at health impact today, you look at nitrogen dioxide concentration today, it exactly matches what you can see on the map in neighborhoods that were considered undesirable back then. So part of the criteria that these neighborhoods were called undesirable was the diversity. So if you look today at white population and non-white population, you can see the same neighborhoods that in 1930s were considered undesirable and today have 50% higher nitrogen dioxide concentration in the air they breathe, outdoor air. Today, they have higher percentage of non-white population, primarily Black, Indigenous, and Latino. This was actually depicted in New York Times. I don't know if you guys saw this or not. And the person that was actually interviewed in that paper is this Ms. Margaret from West Oakland Environmental Indicator Project, who's a true inspiration, great teacher that we work with very closely. We actually support, I co-lead one of the programs at West Oakland Environmental Indicator Project. We have a health equity advisory committee for this community-based organization that was founded by Ms. Margaret. And we actually look through all the issues that are affecting the air quality, and we think about solutions that we can kind of come up with, and we support the community. Now, in addition to air pollution, if you think about climate change, I mean, we all know about, heating temperatures, and we know about heat islands. So again, neighborhoods that were previously redlined are neighborhoods that are hotter in temperature, and also they have much less green space, which leads to higher temperature. There's another study that looked at green space and redlining, and they found the same thing again, that neighborhoods that were in 1930s redlined today have less green space. And we work with some neighborhood greening projects as well, some of them in West Oakland. Another issue that you're aware of with climate change is sea level rise. So sea level rise is not the only problem. As sea level comes up, also groundwater rises. And what happens is that a lot of these neighborhoods that were toxic sites, so they had, for example, an industry, a chemical site. For example, one of the communities we work with is in Richmond. There was a site that many different companies had their industries on, and there's pollution on top of pollution in the ground. So the dirt in that area is just saturated with toxic material. And we are actually working with that community to stop a building project, hopefully, that is obviously puts low-income communities at risk. And I don't know if you're familiar with Toxic Tide Project or not. Again, another excellent project, partly worked on by Morello Frosch's lab. And one of our PSR chapters was a partner in that project that looks at different communities and how far they are from these toxic sites, and kind of reflects on what would happen as the sea level rises. Again, because sea level rise will not just affect who's at the shoreline, it will affect groundwater. And as the groundwater comes up, these neighborhoods, one of which is also in Marin County we work with, that have really no drainage, have no infrastructure, will be just, there's just so much toxic, soup in that water that will expose the community. As we think about climate change, we also think about solutions. So when we think about the solution, we all know the best solution is to get rid of fossil fuels. One of the advocacy issues we've been working on, and one of our PSR chapters, PSRLA, is in the front line of actually organizing this coalition that is fighting to ban oil drilling near people's homes and schools. This is a picture actually from LA at the bottom that you see that there's a school, and you can see actually the drill sites right next to it. It's quite disheartening, but California is actually the only major oil producing state that does not have what they call a setback or health protective zone between homes and daycare facilities and hospitals and oil producing facilities. So there are like about 7 million people that live within a mile of a well. And we actually organized, and we had a bill that we passed through the state legislature that would set 3,200 feet protective zone around homes and schools and other sensitive sites. But oil companies spent $20 million to actually put on the ballot to reverse it, but we're organizing to get it back on. So it's it's a lot of back and forth, but we are working on it. And the reason, I have to finish fast. So this is not something I can go through. This is very complicated. But as we think about climate change, we also have to think about climate solutions. And if you think about health equity and you think about populations that have been hurt the most, that will be hurt the most by climate change, then the decisions we make and the policies that we promote are going to be very different than some of the policies that are being advocated on the national level.
Thank you so much, Marjane. There are so many opportunities within that, both in California, or if you're interested in any of these issues, we can, I'm sure, figure out something that you can participate in remotely. Up next is Megan Wolf. I just didn't see her name. Just want to make sure Megan's here, or if not, I will skip to the next speaker. I wasn't sure if it was another Becca Phillips because my registration was used. All right, I will turn it to Marie DeMarco. So Marie DeMarco is PSR Pennsylvania's health educator and medical advocacy coordinator. Marie's expertise is in public health, which allows her to focus on the health impacts of oil and gas drilling in Pennsylvania. Marie advocates for communities suffering from the harms of oil and gas drilling to local, state, and federal stakeholders. Marie is passionate about advancing health equity and fighting environmental injustices. All right, Marie, take it away.
Awesome. Thank you so much, Becca. As Becca said, I do research on the health outcomes related to methane exposure caused by oil and gas drilling in Pennsylvania. And I've also done work on both indoor and outdoor air pollution. According to the compendium published by Physicians for Social Responsibility National and Concerned Health Professionals of New York, with scientific, medical, and media findings demonstrating the harms and risks of oil and gas drilling, more than 17.6 million residents in the United States live or work within a half mile of an oil or gas well. In Pennsylvania alone, almost 1.5 million people live or work within a half mile of an oil or gas well. And these individuals are exposed to methane, which has a direct impact on their health and our climate. People who are working at the fracking sites are at the highest risk of obtaining negative health outcomes. Individuals in these communities are directly affected by toxic chemicals that get into the air get into the environment through air, water, or soil, and then come into contact with people through inhalation, ingestion, and absorption through skin contact. And I actually am located here in Philadelphia, and in current news with the Canada wildfires, we're actually seeing smog as far down as Philadelphia. Like the city skyline is actually pretty foggy from all of the smog. So, and I thought that was, smog is not cool, but I thought that was cool because I study smog on around the oil and gas drilling areas in Pennsylvania, and just seeing it in Philadelphia was like very jarring. But with this air pollution, individuals in these communities present with multiple health disparities, and these health disparities can include reduced lung function and increased prevalence of asthma, COPD, multiple cancers such as acute lymphatic leukemia, where there is a high prevalence in Washington County, Pennsylvania. Last year, they had 63 cases in one concentrated area of acute lymphatic leukemia. And as well as Ewing sarcoma. Women and men living in communities with fracking can be at risk for reduced fertility outcomes, and these pollutants are an environmental health concern that can also put women at risk for polycystic ovary syndrome, endometriosis, and infertility. Fracking in these communities in Pennsylvania and all over the United States can contribute to socio-psychological health, which can have an impact on a direct impact on well-being. Changes to the environment, such as new drilling operations, can increase anxiety and human distress. In a study published by PubMed, populations that reside around drilling sites had increased levels of anxiety and depression compared to those that do not. And this added stress can increase prevalence of other negative health outcomes, therefore worsening individual health. As healthcare professionals and public health advocates, we know beyond a reasonable doubt that there is no safe or healthy way to frack, and that fracking chemicals harm our health and our climate. As we know, we can hold our stakeholders accountable, as Emma stated earlier, with oral and written testimony, policy statements, and petitions to organizations such as the Department of Environmental Protection, the Environmental Protection Agency, and the White House organization. You can become involved in policy work and advocacy, as well as public health education. Our patients deserve accurate documentation of the serious health risks posed to Pennsylvanians by the unconventional gas development industry. Concerned Health Professionals of Pennsylvania is a resource center for the public, press, and elected officials, as well as other healthcare professionals, to provide resources and education needed to identify the harms of the oil and gas industry. You can become a supporter of Concerned Health Professionals of Pennsylvania if this is something of interest of you. To be a supporter of Concerned Health Professionals of Pennsylvania, you must be a healthcare provider, have a basic understanding of the health impacts of fracking, and be a Pennsylvania resident. If anyone has interested in being a part of Concerned Health Professionals, please let me know. I'll drop my email in the chat after I finish presenting. And you can also subscribe to Physicians for Social Responsibility Pennsylvania's newsletter. We usually put out items that we're working on and things that you can do to get involved. And you can also become a supporter of PSRPA, and or if anybody is still in school, we have internship opportunities as well. And then finally, the last opportunity I have to discuss with everyone this evening is the Education and Advocacy Council that PSRPA runs. It is PSRPA staff, as well as individuals who have interest on climate, environmental, and public health issues. And usually in Education and Advocacy Council, we meet and discuss individual expertise on climate change and environmental degradation. And for the goals of Education and Advocacy Council are to submit letters to stakeholders or op-eds and testifying. It's very similar to Concerned Health Professionals of Pennsylvania, but it's more legal. It's more focused towards legislation. But if any of these are of interest to you, please let me know. And thank you so much. I'm really happy to talk about public health with basically anyone. So thank you for this opportunity.
Thank you so much, Marie. That was really great. I'm gonna pass it on to the next speaker, who is Anna Lanakis. Anna came to Greater Boston PSR in 2017. She's the executive director. After years of community organizing around efforts to protect the Boston region from the threats of Pilgrim Nuclear Power Station, she co-founded the Pilgrim Coalition, developed as a coordinating body of over 30 organizations and hundreds of individuals who came together in the concern of the Pilgrim reactor. Anna served as program officer for the John Merck Fund, where her grant making was focused primarily on environmental health initiatives and the nonprofit landscape in the Boston area. She currently serves as the executive director of Greater Boston PSR. All right, Anna, take it away.
Thank you. So I did not come come up with a fancy presentation with slides. I'm just going to speak. But I wanted to tell you a little bit about our programs. So the Greater Boston chapter was, I always have to say this, we were the founding chapter of PSR in 1961. And we've gone through some, ebbs and flows and some dormant times. And now we have 2 staffers, myself, I'm part-time, and another climate and health consultant, Andy Krasner, who also does some consulting for PSR National. But even though we only have 2 part-time staffers, we have a really robust board. There are 14 members. We just added 4 more, and they really do a lot to keep us going strong. And we have 2 primary program areas. One, we consider them, well, we did consider them the 2 largest existential threats to public health: climate change and nuclear war. Although now we're talking about how AI could potentially become one of those, a third large threat. Whether or not it's up to par with the other 2 is debatable. But so our climate and health program is mostly focused on the impacts from climate change to health, although we do focus on contributions to climate change as well. And a lot of the work that Emma was talking about from our RMI, we have overlaps with, so electrification work in order to make sure that we contribute green sources to the grid. Also, indoor and outdoor air pollution is a high concern to us. Anything fossil fuel related, so fracking issues, pesticide issues, which overlap with climate change issues. We try to have issues that are both local and also tie into national programs. So, for example, we've been fighting a compressor station in Weymouth, Massachusetts, locally, and we find that when we do local efforts like that, it really pulls in people directly in the communities, but then they're also tied to other compressors and the broader issue of what is a compressor station and why should you be concerned about this. So we've connected with other groups in places like Pennsylvania who have compressor stations, and we're advising them as well. And then our nuclear war prevention program, many of you came here with the climate and health hat on, I understand. We find that there's great overlap between the 2. And I feel really strongly about our nuclear war prevention program. We're focusing mostly on a campaign called Back from the Brink, which has 5 key steps to help push legislation that will move us back from the threats of nuclear war. And we have a Boston hub that's tied into many hubs across the country, focusing on our nuclear abolition work. There's actually a resolution at the national level called HRES 77, which is now gaining momentum. And we have 3 of our 9 congressional delegates signed on and 25 across the country. And we're trying to make that more active. And I'm only mentioning our nuclear program as well, because what we're looking for is somebody to help us with communications. And we did have a Boston College student working with us, and she was doing about 5 hours a week of communications work, mostly social media, but sometimes helping us with press releases and so on. And she just graduated, so we need to replace her. We can offer a small stipend, the amount to be discussed, but we are looking for somebody for about 5 hours a week who could help us on social media. And we have 4 social media platforms, but if you're not capable on all of them, even some will do. So we have Twitter, Facebook, LinkedIn, and Instagram. And somebody who's just interested in spreading the word, and we would need you to learn the proper voice for our chapter and the voice for a health professional, using terms that make sense for a physician voice, but that we could do over a series of trainings. And yeah, so that's the basic information, and I'm happy to talk later when we do the breakout sessions. Thanks.
Thanks so much, Anna. I really appreciate it. And I like that we have these different local chapters, so you can please get tapped in if you live locally. Up next, we have Becky Bernhard, who is the Executive Director of Texas PSR. She is a nonprofit leader with experience in legislative policymaking, litigation, and local advocacy. Before joining Texas PSR, She spent 16 years advocating to reform the Texas criminal legal system, police practices, and statewide policies impacting non-citizens. She has served as the ED for the Texas Fair Defense Project, policy director for the Texas Defender Service, and the ACLU of Texas, a senior staff attorney for the ACLU Foundation National Legal Department, and a managing attorney for Texas Rio Grande Legal Aid. All right, thanks so much, Becky.
Hi, everybody. I do not have a PowerPoint either. I'm kind of a late joiner to this effort. Texas PSR is in the belly of the beast. We have I always get them reversed, the third largest oil production and the fourth largest natural gas production in the world going on in Texas. So, you know, there are an unlimited number of issues to address. We also don't believe in telling business what to do whatsoever. In terms of our chapters work, we sort of branch out the rest of our work from environmental health education. We have been running an elective at Dell Medical School for several years and are now working on expanding that elective to other medical schools in Texas, and also incorporating environmental health education into the core curriculum at Texas medical schools. So under that umbrella, there are opportunities to teach as part of the elective, potentially, opportunities to create content for the core curriculum work, which has started at UT Health Sciences, or UT Southwestern, which is in Dallas, and opportunities to help advocate for curriculum changes if you happen to have a relationship with a healthcare institution that is not already teaching about environmental threats to health. You know, the second sort of project that connects to that, at least in my head, is our advocacy list. We get a lot of requests for healthcare professionals to testify at EPA hearings, to participate in press conferences, or to participate in educational webinars or opportunities to talk about the health impacts of all sorts of things. Electric school buses, you know, whatever EPA rule is currently being adjusted, and how we really need to do that. Because, you know, Texas suffers from whatever the worst outcomes are when the EPA doesn't act. So you can just join that advocacy list and get information about advocacy opportunities related to Texas. We also have something called the Red Bag Project that was created by a student in the elective at Dell Medical School, and or one of the students in the elective. And oh, excuse me, I was trying to read my chat for a second. It is a project about decreasing waste and the carbon footprint of ORs. So it's at 8 different medical schools where there are teaching hospitals, and they're working to do an audit of the waste produced in the OR, and working to reduce that waste. We also have a little project that's trying to get off the ground on sustainable food in hospitals, both you know, more plant-based and more environmentally friendly practices in terms of purchasing. We have, I guess, a very, very nascent PFAS project. We know that forever chemicals are used in the extraction process for both oil and gas. And we have parts of Texas where literally tons and tons of PFAS are being used and ending up in the water, which generally ends up either in the groundwater that people drink, or that crops are irrigated from, or animals. So that's another opportunity, and I'll be happy to talk to anybody more.
Thank you so much, Becky. I really appreciate it. So last we have Lisa Van Susteren. Lisa is a general and forensic psychiatrist and frequent contributor in the media. Van Susteren is the author of numerous publications, including The Psychological Effects of Global Warming on the US, why the US mental health system is not prepared, and emotional inflammation, discover your triggers and reclaim your equilibrium during anxious times, and is the co-founder of Climate Psychiatry Alliance. She is the expert witness on the psychological damages to young people from climate disruption in Juliana versus US. In 2006, Dr. Van Susteren sought the Democratic nomination to the US Senate from Maryland. All right, so I'm going to do something a little bit different. I'm going to be asking Lisa some questions that she has prepared, and she'll also be going over some opportunities as well. So the first question is, what was your epiphany?
Let me just interrupt you one
Yeah.
second and say
sure.
that I apologize. Is there a lot of ambient noise here? No,
No.
it doesn't sound, okay. I am at a dinner at honoring a very good friend, and I have slipped away from the table to be with you. And I ask for your indulgence for the setting and hope that everything works out well and we don't have any snafus, even in these just the 5 minutes ahead. So thank you very much. And I'm sorry for interrupting, Becca. I just
you're
wanted to
good.
make sure it wasn't too noisy.
Thank you so much. I appreciate it, Lisa. So first question is, what was your epiphany? How did you get involved and started in climate advocacy work?
Now I'll say, second of all, thank you all for your work with PSR. It is such an honor to be involved with this group, doing so many wonderful things. And I wish I could ask each one of you what your epiphany is, because it's so much fun, at least for me, to hear what was that moment. Sometimes people drift into it, but many times I think there's a real awakening. For me, it was when I was running for the Senate and I was thinking about stem cell research and it being blocked by our potential presidential, potential president George, no, I guess he was in office, Bush, I can't remember, and also invading Iraq. And I kept hearing about global warming, this 2001, and I was thinking, I got young kids, I can't deal with recycling right now. And this is the kind sometimes of thinking that goes on in people's minds that we don't realize is really very unsophisticated. Well, needless to say, things changed. I was asked by Gore to join his first 50. I assumed that I would be out of a job on climate issues within minutes because everyone would do the math. See, we couldn't possibly go beyond 490 for heaven's sakes. And that would be the end of it. And that's obviously not what's happened. But when we look around, it sure seems like we've got quite an impressive cadre of people who, once we reach that tipping point, and just as there are climate tipping points, there's social tipping points. You look around at what we see tonight, it's hard to think that we aren't going to reach it soon.
Okay, I'm going to move on to the next question.
Yeah, just forget, but you don't have to ask all of them.
Yeah, well, I wanted to ask a little bit about what recommendations you have for activism generally. And also, I think an important one that you mentioned is what have been the effects on family and friends, and how have you navigated that?
Yeah. There, all the things that are important with respect to activism seem to start with a P to me for some reason. At the top of the list, what hangs over absolutely everything is perseverance. I have seen time and time again that it's really the people who pick themselves up and dust themselves off and continue and don't take no for an answer or don't take a reversal as their theme, and they persist. So there's another P, perseverance, persistence, whatever, they all come up as P's. The other P's that I really think of as being a really good activist involved, finding out what your personal footprint is. Find out what is difficult for you to change, what's easy for you to change. You're going to be an especially persuasive person if you know what your what's on your conscience. And then there's all the work that you can do with professionals, all the people that you know. No one should feel ever that you aren't a burr under their saddle, reminding them of what it is they need to do. Publicly, all of the works that we're doing here tonight, talking about tonight, this is just our way of changing society. And sure, we're doing one-off things sometimes, but we're setting a social norm so that more people join our work. Then there's, of course, politically, making it our a litmus test for the people we support or running for office ourselves. We'll support you. And last of all, we can't deny the role of protest at times. So those are some of my P's. And I hope that those are promising to all of you.
Thank you.
Or I've been persuasive.
Definitely. I like the P theme. All right. My next question is, what current projects are you working on?
Okay, well, too many, like as many activists, we often can feel as if we're just chock-a-block with activities. And these are efforts that we meaning my colleagues, particularly in the mental health field, but other fields as well, are very eager to have the help in the particular issues that we're working on. As I think about what would intrigue you perhaps most and what you could help with, is we're working with 211.com, .org, which is gets 22 million calls a year. Believe it or not, they're an emergency services, but they only had it for legal, medical, housing, and domestic abuse, etc. Nothing on climate. So people who are really in distress had no place really to turn. So it's a combination of a climate hotline, but 211, if you're not familiar with it, whatever your area code is, it'll funnel you in to a volunteer who answers the phone, addresses your sentiments wherever you are. And one of the things that we do is try to take where you are and redirect all that anxiety, distress, anger, whatever it is, into constructive action by connecting you with groups that really speak to what your interests are. So we need volunteers, we need helpers to execute 211. We can use anything there. We also have what's called the Outreach and Advocacy Committee, which is a joint project of the Climate Psychiatry and Climate Psychology Alliance. We are working on local levels. So we are working with state legislatures. We're working with county councils. Of course, we're working with governors, the Governors Alliance, et cetera. A couple of weeks ago, we met with the new climate chief in Massachusetts, Melissa Hoffer, bringing the issue of the mental health toll, which people seem not to understand. Every physical injury or loss carries with it an attendant emotional toll. And sometimes that's worse than physical, where you can at least see the damage. Sometimes you can rebuild, replant, restore, but psychological scars are much harder to treat, and their tentacles reach into every single domain that humans touch. So we are looking for helpers to work with us. We meet every first and third Monday, and we have letter templates. We're working with Florida, Connecticut, New York, Maine, Massachusetts. We've got a group starting in Minnesota. I'm hoping as a cheesehead that it'll be Wisconsin soon, and other states. But we would love to have you join us. We're mental health professionals, but we've got people who are in other domains. Everyone's welcome. We also have a couple of other efforts, but I'll leave it at that in case you have something pressing, or we're at the 5-minute mark, Becca.
Yeah, if there's any other opportunities you want to speak on, now is your time.
Okay,
where you
I do. I will say one more. We have something called the Eco Psychopedia. Psyche, not psycho, although eco psycho would certainly fit as well, but it's eco psyche, and I promise we'll have an easier site with a nickname, easier to spell, but it's Eco Psychepedia. And we have people writing about their areas of interest and expertise. It's a little bit like a Wikipedia for everything that has to do with the environment and mental health. You are welcome to look at that, contact us, offer something that you want to write, 1,500 to 2,000 words, and join us in planning for this, expanding it. We're probably going to be working with the Planetary Health Alliance, now a fusion of Harvard and Hopkins. And I say working with them, they want to work with us to make sure that we launch it and that we have access to their listserv and their experts. So working with them may be a little bit of an exaggeration, but we're certainly partnering in this effort, and we'd love to see you anywhere you're interested.
Thank you so much, Lisa. That's so wonderful.
Thank you.
Yeah, thanks everyone for taking time out of your busy schedules to be on. So before we go into our breakout portion, I did want to just very, very briefly talk about the two speakers. Megan had a tech issue that we were trying to resolve, but didn't work out. But she works at Beyond Plastics. So she doesn't work with PSR, but if you're interested in anything involving reducing plastics, especially in the healthcare space, or just all the toxins that come from producing and just using plastics, she's a great one to reach out to. She's going to send me also all the opportunities I will send out to you. And then Ons is a pracademic, and he is now at the University of Southern California Keck School of Medicine. And he was going to present about different opportunities in research and academia. So he'll also be giving me a list of different opportunities. So I know that was a lot of information, and so many different ways that you can get involved. So no worries if you couldn't take that all in. I will be sending out this in written form and also a recording, and you can send it out to colleagues, of course. Now we're going to shift into the breakout room portion. So the way that this is going to work is I am going to make it so that you can actually join whatever breakout room you want. So right now I know that Lisa, I think, has to or already ran. So we just have five of our awesome speakers here. And these are all of the different breakout rooms that you will be able to join. So number 1 is Emma, number 2 is Marjane, number 3 is Marie, number 4 is Anna, number 5 is Becky. And then you can join and you can hop between them, and I'll leave them open for about 20 minutes about 20 minutes, and then we can come back and wrap up. All right, so I'm going to create the rooms and then you can go and join as you like.
Becca, before you do that, do people know how to hop between? Is it obvious?
Oh yeah, that's a great question. So you just have to come back to the main room and then you can go to another room. That's all you have to do. So these are the 5, and then I'm going to create the breakout rooms. So it'll just be 5 of them, and then you can just decide which one you want to go to. So I'm opening all the rooms. Feel free if you need to hop off, that's all good. But there's also a great chance if you want to become involved and speak more with the speakers. Thank you. Devin, do you need help?
Yes, sorry, I don't see any options to join the breakout rooms on my screen.
If you go to breakout rooms, you should be able to hop in you just press join.
Okay, I see.
Okay,
Thank you.
awesome. Yeah.